It's very big pleasure and it's very big honor for me, Prof, to have you. It's, let's say, the very safe conversation and podcast. As you know, I'm one of your big fans, and I'm one of the biggest or very active readers about your research in the field of dentistry. And at the end of this podcast, I should try to ask you if you accept to be my mentor. So I really thank you because you accept our invitation to have this podcast with you, Prof. And do you just tell me how's your experience in these 2 days in Iraq?
Okay.
Yeah.
Anyhow, at first, thank you very much for inviting me to this very great opportunity. I'm very happy to join your program here. And of course, this is the first time for me to visit Iraq. And so I was very much impressed to see the passion of the young dentists to learn something new. And also the city is very well maintained, and all the part, especially Stadium, is very well maintained. And I really enjoy the visit to that old place very much. And the people are very nice, and I could enjoy the talking and sharing this time with those people. I really enjoyed these 2 days. And today, I'm very happy to talk about the data cleaning and the data research today. Thank you very much.
At least you just try to visit the north of Iraq, and the next time we ask you to come, and also because this is a very big chance for us to show you for the people in the south of Iraq, in the middle of Iraq, and of course we will ask you again to come to Iraq, please, because people, I saw the things in their eyes. They were happy to see you on the stage. They were happy to see that you're sharing everything with them. Without any ask or without any governments. You are very generous, and this is the things that I saw in Japan, especially people there where you are the good example for Japanese people here. So really thank you for this again, Prof. So we don't want to waste the time because we have a lot of questions here. So the first question that I wanted to ask you about is how has your clinical philosophy evolved over the years?
My philosophy in clinical practice is just to provide the latest knowledge and information and technologies to my patients. Actually, I really enjoy the clinical path myself with my patient, and the fundamental philosophy of my dental treatment is the so-called minimally invasive approach. And I always try to maintain the natural tooth or natural teeth of my patient for their whole life long. For that purpose, I always try to choose the best treatment option to all the patients.
Okay. So, do you see that the minimal invasive dentistry is the future, or it's at the present right now?
Yes, of course, it is the future, and also at the moment we can working under that philosophy. However, unfortunately, as a dentist working in the private clinic myself, I'm working. Sometimes the minimally invasive approach is not so good for the business of the dental clinic. So that's why, of course, that philosophy is very important and very it contributes for the oral health of the patient very much. However, we have to think about some other kind of strategies to promote that philosophy to the patient. I'm not trying to do that in Japan, and my patients are happy to pay more expenses for the value of the minimally invasive approach, not for the material.
That's great. Prof, I want to just focus on something which is playing a very big role right now and nowadays. The issue is when we are dealing with composites in our countries right now, maybe in Middle East, maybe in also Europe, Latin America, when we're dealing with composites, still now we have some question talking about the longevity of the composite, okay, of the resin also, and belongs to what we saw from your experience, and especially I saw a lot of your cases in the and research and about them. We were extended to have a longevity more than 30 or 40 years. So I think the situation in the past, in your time, maybe in 1970 or 1980, it was difficult to make people believe in restorative dentistry, or sorry, the resin dentistry, the composite or something like that. If we are comparing with it right now, it's easier right now because you have research about that. But how was your experience at that years in order to make the people believe in the resin, which is comes to the dentistry very newly at that years?
Yes, I spent considerable time to talk about my patient regarding the treatment options. And I always explain my patient that in the case of direct composite restoration does not require the cutting of your intact dentin.
That's the key.
Yes.
Yeah. So from this point, you start to just make the people. What about the dentists? How they believe in the resin?
Of course, it was a very, very difficult issue to let majority of the dental clinicians understand the advantage of the composite resin. But I often say that we should think about the longevity of the teeth, not the restoration.
Very good question. Very good answer. Especially, because we always think about the composite or the restoration, not the tooth.
Yes, of course, we are the dentists, but sometimes we should recognize ourselves as the dental therapists.
So we will accept the truth that we can fail in the restoration, but at least we not lose the tooth structure.
Right.
This is the right answer for this.
Yes.
So maybe we'll have failure, but we don't lose the tooth because we can't treat it.
Even with zirconia, even with ceramic, even with the precious metal restoration, they have some problems, especially at the margin of the restorations, and sometimes the root itself.
Yes.
So that's why all the restoration has to be repaired at the end time. So that's why if we consider about the method of the repair, the direct composite must be the first choice.
A very, very, very good thing that we are focusing on this point, because when I was reading about occlusion in the past years, I was thinking all of the schools may be talking about how to proceed the restoration or how it won't long stand. But at least they didn't think about to preserve the tooth structure. So the forces that we all have from the opposite teeth, it may be destroy the tooth itself, but the restoration will stay in the place. So there's no advantage from keeping the restoration and at the same time have destructive tooth. So very, very good thing that I have from right now to think about the tooth.
Also, nowadays, after the restorative treatment here, the recommendation to the patient to use the night guard to decrease the risk of the occlusal stress is very important. So, and now I always recommend my patient to use the night guard.
All of them.
Yes.
Most of them.
So it is also very effective to prevent the tooth wear, because all the people has to live very long period. So that's why.
Very, very good thing, because yes, this is very important. I will take the advantage to think about this twice. Another question that I got from the social media: what's the biggest misconceptions about adhesive system today?
Nowadays there are two categories of the adhesives. One is the traditional etch and resistance, using the phosphoric acid etching to both enamel and dentin. It works very well. And also another group is a self-etching material. Nowadays we have the one-step self-etching adhesive. Sometimes they are named the universal.
Yes.
And both of the systems works very well. But if we evaluate the quality of the dentin bonding precisely, we confirmed a lot of advantage with the self-etching material. But still a majority of the clinicians in the world, they continue to use the H&Bs.
So you see that still it's the total H it's relevant till 2025, the total H adhesive system, if we're compared with the universal bond or the self-H bond.
Maybe the selection of the adhesive system will be changed gradually.
Okay.
Yeah. But I suppose the self-etching material will be increased.
So from this is a special question from my side. If you have a thought or you just think about how many years that we can have the follow, or at least the range of the follow-up that we can get from universal bond. Of course, it's very difficult to just think about how to have it, but let's put an answer, a simple answer, in order to encourage people to use the universal bond.
Of course, the clinical performance is not so easy to understand very well. However, a lot of research papers done in the laboratory testing proved that their bonding performance is very reliable. So as far as we know that fundamental performance of the material, we can utilize it. Then, of course, we should follow up those critical cases very carefully. If we can find out some problems with those restorations, again, we can replace it. In that case, again, we don't need to cut the two substance anymore. So this replace is possible. But I believe that we don't have so many cases requiring the repair.
Yeah, of course. But another thing that I wanted to ask you about is, do you prefer to etch the dentine or not? The answer that I want from you is not there.
So of course, I etch the dentine with self-etching material. So that's why the etching effect is very mild. Still, the bonding is very excellent and reliable. So that's why we don't like to use the phosphoric acid for dentine.
That's why. Anymore, we don't need to use it. We keep it on enamel.
Yes.
And we keep the self-etch bond on the dentine.
Yes.
So this is the good answer that we have. Also, we have another question. Do you think that dental adhesive achieved their full potential or not?
Dental
Adhesives.
adhesive.
Yeah.
Yes. Its potential is very high. They were already confirmed by various research papers. I can say that in the past time, I often had a question of how much bond strength value necessary. And I try to answer to that question. We evaluated the tensile strength of the tooth itself. Of course, enamel is very easily broken, and dentin also shows some kind of strength, but the dentin enamel junction, Bay junction, show the fracture very easily. That tensile strength was about 50 megapascal. Wow. The recent adhesive material, including the H&Bs and self-etch, some of the self-etch material show more than 80 megapascal. So that's why if we can bond the composite onto the dentin appropriately, we can
overcome the
build up the components that is stronger than natural tooth.
The very good thing that to hear this from you. Yeah. So we can't just pass the 50 already if we do everything special way in the correct way.
Yeah.
Very good. So let's talk about something which is tricky, and they always ask about it. Belongs to the deep margin innovation cases. Yeah. The materials that we know to use it from the old years, they were think about to use the glass enamel cement. So because of the hydrophilicity of this material, what do you think that the composite can just replace this material? We already use it then right now nowadays.
As far as we can isolate that restoration margin at the subgingival area, of course we can apply the direct composite restoration. But if in the case of very difficult case, of course, still it might be good to use the gross annual cement at that area. Yes.
So you prefer for the deepest, which is you cannot isolate very well, there's a chance to use the
Yes.
Yes.
Sometimes I section the gingiva, or sometimes I feel the gross annual cement and add to the super.
Then you continue to do using
Yes.
composite. So when we just when we are thinking about the gaps, the things which is missed till now in the adhesive dentistry, what are the things that you think that we have till now we have missed in the adhesives?
Yes. Of course, we can find some publications. However, the bonding in the previous situation is not fully analyzed, evaluated. For example, of course, the bonding to the care is affected in the
Yes,
one of was found to be lower,
Yeah.
and also the eroded dentin, because the surface area is slightly demineralized. That's why the bonding mechanism must be different from the normal dentin. And also, in the case when we provide the bleaching to the patient, we cannot apply the direct bonding immediately after the bleaching.
Of course, yes.
So of course we can wait for 1 week or 2 weeks, but of course we have to develop some kind of bonding procedure that will be applicable immediately after that.
Yeah, I thought one of the papers that I read about to do it after using the bleaching materials is correct to use the sodium hypochlorite to prepare the surface, and you can use the bonding system after that directly, or this is just missions used. What do you think?
Yes. The bleaching agent and sodium hypochlorite solution for endo treatment has the similar action, and especially to reduce that influence, we recommend to apply some kind of dual cure activator. That is very effective to reduce the influence of the residual oxidants.
Okay.
So we confirm that we can recover the bonding.
Okay. Among the universal bonds, right? Because we have multiple companies which is dealing to just develop the universal bonds. What are the things that makes us to say this universal bond is not saying stronger, but let's say preferable than the others?
Yeah. When you think about the procedures and the handling in the clinical situation, in many cases, the simplified bonding procedure is preferable, especially for the child patient, and also some difficult situation of the patient. And also the margin elevation technique is one of the. And sometimes I apply the universal bond because it does not require all the basing and drying. Even with that kind of pressure, sometimes we observe some bleeding a bit. So that's why that kind of pressure, stress, and some stimulation to the gingiva should be avoided. So that's why universal bond is recommended. And also light irradiation, both by means of the heating. Again, we see some bleeding from the gingiva. So in the case of the Tokuyama universal bond, it does not require the application time. And then immediately after that, we can remove the excess of the material. Then we don't need the irradiation. That's why we can move on to the application of the composite, especially probable composite combination glue.
That's why.
Yes.
So you prefer to use the for the composite restoration. You prefer to use the chemical cure bond or the polymerized bond or the cure bond?
In that kind of situation, especially the margin elevation technique at the deep part, the dual cure type of composite may be better. But even in that case, the sufficient light curing is required.
Even we are doing that.
Yes, the mechanical properties, very big difference between the dual cure and the chemical cure situation and light cure situation.
So you prefer for deep margin, even we have the dough and the chemical cure or double cure, we need to apply it a lot.
I can say that, but in my clinic, it's not so easy to choose the different material according to the cases. So honestly speaking, I always use the flowable composite, like you are saying.
You like the flowable composite?
Yes. Yes.
So the advantages of the flowable that you think is because we can reach all the spaces, all the areas.
Yes. And also we don't need to apply the pressure.
Yeah, there's no pressure.
Yes, that is very important.
Does the pressure is affecting the adhesive system?
The pressure does not affect the bonding, but if we apply the pressure to the case-type composite resin, sometimes the gingiva is pushed back to the cavity side. Then the gap is created.
That is why.
Yes,
So it's preferred to not apply any pressure on that. So in this way, if we're dealing with pest composite, or pack on the composite, what is the best way to pack them inside the can if we don't want to apply the pressure?
In the past time, I tended to prefer the very soft paste.
Okay.
Yes.
So this is better.
Yes.
Okay. So we try to go with the paste. If we have the composite, which is very hard to manipulate, it's preferable to use the heated composite or reheat the composite.
I have no idea about the heating, but in general talking, the applying the heating to the chemical product may not be recommended.
That's why we don't go with the direction of heating the composite. I mean, we saw it. Belongs to myself. I don't use the heated composite, but I see a lot of my colleagues trying to do this because they think about to have good manipulation of
Yes, we should know that the mechanical property after the polymerization and the consistency before the polymerization is a different issue.
That's why.
Yes.
Very nice. Very nice to just think about this. So let me go with technology a little bit. And with technology, the new technology that we have, do you think that the AI right now, the AI is just affecting the adhesive system right now? We can't take advantage from using AI?
I don't understand the potential of AI so well, but yes, the current CAD/CAM system is a part of AI assisted dentistry. But when I think about the CAD/CAM systems, that is a very excellent technology. Everybody accepts that. But if we try to do that restoration, we have to prepare the cavity, we have to prepare the preparations according to the request of the AI. So it is not based on the treatment method. It is based on the traditional restoration procedures. Of course, we should not be some kind of undercut of the preparation. That is a request of the AI. But in the case of the direct restoration, we just remove the region, so caries region. So that is the disease-oriented system. Okay.
Got it.
So that's why even with the recent AI for assisted treatment, it is not the NY treatment.
That's why. And sometimes I have some thoughts that say it's out of the planet. And it belongs to me. I just say these are very silly questions, but this is just those. Belongs to the bond strength and the resin strength that we are using. We have some devices which we can use them to measure the strength outside the patient. Like we are using the vitreous study, the extract team to apply the bond, and you check the strength of the bond. Can we develop a device that the dentist can use it inside the patient mouth after he finalized everything, to measure the thickness of the material that he used. So it's the strength of the material that he used.
In the future, it must be possible to evaluate the strengths in the mouth, but at that time, the performance of the material must be very high. If you try to break the specimen in the mouth,
Difficult.
mouth,
Yeah.
the tooth is broken.
Yes. So it's impossible to do it unless you have very strong material.
Yes.
So if we got them strong material, we don't need to measure
Yes.
that. Actually.
Also, that is the same of the selection of the restorative material.
Yeah.
Of course, even in Japan, majority of the dentists like to choose the very hard material, like zirconia and ceramic. They are much harder than natural tooths. So that's why sometimes we see the fracture of root of the patient. And in my thinking of the restoration, I think I always like to choose the material that is comparable, more weaker material for restoration. That's one natural tooth.
That's why. I have a very special question, which is I already asked by the colleagues there. I'm very new about research, and of course, one of the people who was I really for them, of course, you, the Prof. I want to ask you, what advice you will give to the people, the young people who is interested or who are interested to be researchers?
Research, yeah. Okay. I can say that the fun of doing the research is just once we have some result with even a small project, the information is the newest and the top of the world at that moment. And we can reflect that result in our clinical procedures and the treatment method. So we can realize that I can contribute to the development of the dentistry as well as we can contribute to the society.
Of course, this is the questions that I have already scheduled. How do the clinical challenge differs in Japan from other countries?
In Japan, fortunately and unfortunately, the governmental health insurance program is very well established. It's very good for the people, patients. However, all the treatment fee is fixed very low level. That's why all the dental clinic and dentists has to take care of many patients in a day. So that's why, because of that, we could not spend sufficient time for each treatment. As a result, sometimes quality of the restoration, quality of the endo, or the treatment becomes lower. That is a problem. To maintain the high quality of the treatment for the patient, we try to reduce the number of the patient per day. In that situation, we have to charge more to those patients. But fortunately, nowadays, many of the patients are happy to pay for that kind of dental care.
Which is very different at the other countries. But that's why they say it's another planet. Okay. What role do international collaboration play in advancing data science?
International collaboration, at first, it's fun.
Okay.
Of course,
Okay,
communication from the people from the different countries is always fun to know something new. We can learn different culture and thinkings, and it's very fun. Because of that kind of background, sometimes the other people has a new idea, different idea, even for the same topic, and different experience also. So that's why it is very effective to enlarge our thinking and possibilities.
Okay, I have a question which is not clear for the colleagues there. Belongs to the research, especially in the adhesive dentistry. which one of them is closer to just make the research go fast and get the correct or the excellent results when we are dealing with chemist or the dentist who is going in dental material, expect with dental material? Which one of them doing the research, especially for the adhesive dentistry, let's say very effective?
Actually, I'm not a chemist at all. Okay. Yes. But I'm just a user of dental materials. Communication with the developer, like the chemist and the engineer working in the dental manufacturer, is very important to understand the characteristic of each dental material. So understanding the characteristic of the material, including some chemistry, so we can think about the most appropriate method to apply the critical situation. So that's why for many years in my department, we invited the chemist and the engineer from the manufacturers to give the lecture.
That's why.
Yeah.
So from this field, let's just ask about something which is very sensitive. If we got the bond and the composite right now in my clinic, it's preferable to read how to use them from research, or I can take the advantage from reading the cautions that already the manufacturer gives to us. Which one of them is the best for us?
We always try to evaluate all the material, comparing their performance in a same project of the research. Of course, the performance is influenced even by the operator. So that's why the same operator, same project, we can compare them all is the same paper. Okay, well, then we can discuss about it. But sometimes the tendency of the results is not the same each other. Sometimes we still continue to repeat the experiments.
Okay. Yeah.
That nowadays it's not so easy to select one product because all the products perform a very high performance.
Of course, of course. Another thing that I wanted to ask you, especially from my side, belong to the self-adhesive bolts. Do you prefer to use the sandblast on dentin or not? Before we are prepared to use the adhesives. So you prefer to sandblast them, and if you prefer, how to do it in the way that we can say that we didn't be harmful with it.
Okay. If we don't use the sandblasting, we usually cut the surface with high-speed diamond or carbide bar or low-speed bars. And each cutting method creates different character of the smear layer. So that's why each smear layer has a different response to the acidic treatment, self-etching procedures or Chinese procedures. Okay. But anyhow, in the case of the sandblasting, the quality or characteristic of the smear layer must be different. So, that's why we should establish the most appropriate bonding procedures to that surface. If it is established or confirmed, okay, it's better to apply the sandblasting because the variety of the variation of the smear layer by sandblasting is smaller than the bucket.
So if right now I want to be in the side of the people who's using sandblasting, so this means that I should prepare the surface by the cutting instrument in order to say I can use the sandblast or not. This is the answer. So if I want to use it, what I should do, which instrument of cutting instrument I should use in order to have the chance to use the sandblast?
Yeah, anyhow, the cable surface enamel margin is very brittle. So that's why at first we prepare by the high-speed batting of Feren. And after that, that margin should be beveled or trimmed by the sandblasting or the fine particle side of demo.
Okay, that works. So One of your papers, Prof, which is I read it in a very good way, which is recently already published, talking about that the normal occlusion or occlusal force can create cracks. This is what we already reached, and the proximal, it's just extend to the proximal area.
Yes.
I think a lot of readers asking about, can we prevent the spots or this problem that will happen? We already answered that we use the night guard,
Yes.
but we can't do anything to prevent this also.
Yes. It is very important for symptoms.
Okay.
That has to be seen majority of the people, even though we cannot confirm it in the mouth. Even with the X-ray, we cannot confirm it, but it is really exists that kind of small cracks and the defect,
Okay.
especially at the contact point or the personal contact point. And we should take care of all the patients that they should have that kind of problem already. So that's why when the patient accept our maintenance program periodically, I always try to apply some fluoride or preventive material at the proximal area.
That's why.
Yeah.
So belongs to, because you are one of the people who's using, they like to use the flowable composite, and we learn from you. We have multiple types or multiple types of the syringe in Tokuyama. The high flow and the medium flow and the low flow, super low flows, the green one. Which one you prefer to use in contact with the bond?
Of course, the high flow must show the very flowability to react to the bonded surface of it. But the low flowable composite is also flowable enough to wet all the bonded surface of action.
So you prefer to have highly flowable composite or low flowable composite?
High flow, medium flow, low flow.
Yeah.
Means low flow. So
High
high flow.
Yeah.
So because it's easy to control. The very flowable one, it flows to unexpected area. So sometimes it is very troublesome.
Yeah. So which one you prefer to use?
Always
Low flow because it's stronger and it can control whether you.
Yes. And also it's easy to create some kind of very precise anatomical shape.
Okay. That's because we talk about the final loser layer. So what was there a case that changed the way you practice?
Yes, when I was young, immediately after the graduation.
I want to hear from the history.
Yes, okay. Many of my patients had the silver barrel metal restoration because it was done by the initial treatment. So that's why when the Japanese dentists provide the restoration, always they apply the shot and cut it, take impression, and next minute bonded out, rooted the metal. So that's why at that time when you see the Japanese people smiling, you can see a lot of metal. And when I was young, I enjoyed the nightclub in Japan.
Yeah.
And beautiful lady said that I told that I'm dentist. Yeah. She said that I have a cavity, but I don't like to go to dentist. Why?
Why?
Because I had to have the metal restoration.
Oh, that's why.
That's why. So I noticed that is true, but I really noticed that the people really don't like to have the metal restoration
because of the color.
Yes.
That's why it changed your mind to go with.
Hopefully, so I was lucky because in 1980 or 82 we already have a posterior composite.
Yeah.
So I could use it.
So the advantage from that time. Yeah. So it kept you with. Very nice. What motivates you to keep teaching and innovating after so many years?
I don't know myself so well, but I really enjoy this kind of activities. And the research is fun, and the teaching to young student and young dentists is also very fun. And maybe it's not all, but some of the people attended my lecture. They said, "Oh, the information was very, very valuable with it." So I'm very happy to hear that. So that's why I cannot stop this idea.
Okay. I asked you something behind the scenes, but I want to read the question because I don't want people to know about this. Among the countries that you already visit, which one makes a beautiful expression in your mind and you always remember them? Which country?
Wow. I visited so many countries, and most of the countries was so nice and impressive. Uh, but I'm sure visiting this area in Iraq will be one of the most impressive travel for me because I had never been here before, and also I didn't have any information about the dentistry in this country. And so today I knew that there are mostly 70 dental schools in the country, and there are so many dentists here. So the dental profession society it is very, very competitive. Fair. So as a result, the mm, quality of dental treatment will be
Will be higher, yeah,
Yes.
because of the competition.
yes.
Since you saw a lot of lectures yesterday from the guys, from the dentists there, do you find the quality is good till now, or it's more than good, or it's normal, let's say average?
Yes, more than good. I have no doubt about that because all the people are very good at speaking English.
Yeah.
And the English program is provided in any places, and you are always catching up to the latest informations. So I really noticed that all your lectures are very up to date, and also sometimes I felt your lecture very, very humane.
Yeah. Yeah, that's it.
Afterwards, yeah, there was sometimes very difficult situation of the margin elevation technique. Yeah, so finally you recommend the technique that freehand building up. It's okay.
Yeah.
But it's a very honest information.
Yeah, I was thinking about that because I told you, I learned from you.
Yeah.
Freehand is easy for you then. You
Yes.
can do it, especially the material that just to talk about if it be a human vein, they can use it easily. The only things that they need to
Yes.
do is just taking care of the patients.
Yes.
That's all.
So freehand technique.
Yeah.
That is on that age to use the floor.
This is which encouraged them to
Yes.
use this.
Yes.
So you see the direction we are going toward this. We will use the flowable one that will come with it. You see this?
I have never used the very hard composite. Like, of course, in the past, we have only that kind of base.
Yeah. So if you were to start over today, what would you do differently? If you want to start from now.
My life?
Yeah, you're.
Okay. So, just before my retirement, maybe more than 5 years, I had to work for the administrative work in the university and managing the works. So, if I can start my life again, of course, I will be a dentist, and I will continue. I will concentrate my work in the training and the research, and hopefully some education.
That's right.
No one mistakes.
That. This is the ideal. I have something in my mind. I was thinking about. I was traveling around a lot of countries. You did the same, and I saw a lot of schools, research schools, and when I compared between them, I found the Japanese school is very informative, and there's no limitations for their fellows about the research. So I think they are one of if we don't say they are the best, they are one of the top 3 in the world right now as research schools. Belongs to Iraqi people or dentistry, well, they are very good in clinics. They are very good clinicians. But the thing that we are thinking about, we want to take advantage to make the young people to take care about the research. So from my side, I will ask something which is all of the colleagues in my because let's say I have some sound, very loud sound, to talk about what's happening, and instead of them, can you have some collaboration between the side of Prof. Tagami and Iraq in order to have collaboration to make a school here or something like that, or a programs to start the let's say start the way to make them go in the direction of research and help each other to do this?
Yes, of course it is possible.
Yeah.
And so for everybody or all the researchers in the world must be very welcome
Yeah.
to increase the collaboration with the foreign countries.
Yeah.
And of course, in the past time, in my department, our department was really open to anybody to join our research project. And also in Japan, we have a very big advantage that we can very easily collaborate with the manufacturer.
Yes, because all of the brands is there.
Yes. So, and even for the young researchers in Iraqi, of course, you better to try to promote the collaboration with the manufacturers in Japan and European countries and United States, anywhere. So, and but some of the manufacturer, their attitude to collaborate with the researchers is a bit different.
Yeah, for sure.
So
There is a chance for this. We can do it.
yes, of course.
Perfect. What are the final thoughts or the message for the young clinicians?
Young clinicians.
Please.
I don't have a good suggestion, but according to my experience, all the time I could enjoy the clinic. Of course, including research. That as a clinician, I enjoy the clinic very much. That is why we could create a very good relationship with my patient. Some of my patient is now already more than 90 years old, or in a long life. I could continue to communicate. Sometimes I took care of them, and that is one of the most important treasure as a dentist. Yes, to making a good relationship. So of course, when I was young, I had a dream, but all the dream do not be fulfilled. That is true for everyone. But having a dream is very important. Keep the dream in my mind, in my always. But do not rush.
Don't rush. Only go normally with your clinic.
Yes. We should do our best what we have to do now.
Without rush.
Yeah.
Yeah, very good. Yes. So I have another question, and I would not want to just take too much time about what we did, because we have a lot of questions that they ask. Where can people follow Dr. Tagami, the new research that he will do? Especially which place that we can find the new one?
For the new research.
Yeah, the new research.
Okay. As far as you work in the clinic, you must have many questions.
Yeah, for sure.
Yes. So each question should be confirmed by some of the laboratory testing. So start with the small question, and in any conference and seminars, most of the question from the audience is the same. That question is also the same for the speakers.
For sure.
Speaker cannot provide good answer to that. That's why all the people ask the same question. That is very important to evaluate as a research project.
That's why. The last question maybe will be very smart thing, because now I think the people start to think about it. You just heard about the printed resin, the resin that's used in the 3D printers. If we are comparing between the conventional composite or conventional resin and the printed resin, do you see that if we just, let's say, we left or we minimize using the compression on composite and we go to the direction of using the printed resin, is it wise?
At the moment, the quality of the 3 printing resin is not so good to apply in the directory. At the moment, the possible application is to produce a kind of a silicone index by 3D. That 3D printed silicone index is very nice, especially in the case of our direct grease technique.
Okay.
We can create the hollow structure index.
Okay.
So
As index, and we can inject.
yes,
Yeah. So you only recommend to use it in this way, no more. Maybe we don't have much papers which is published about the printed resin yet. That is one of the
the
reasons.
mechanical properties and the accuracy. Still, they have a lot of issues.
Yeah. So, Prof, I really thank you for all the answers that you gave. We already we have the let's say the dream to meet you in person. This was one of my dreams because I was following you since a lot of years, and this became true. I hope that we can meet you so soon again in Iraq. People are looking forward to see you. We saw the crowd that we had yesterday. All of them think about 100 again. And especially, I want to thank you because you did everything to make people believe in something which is new, changing the mindset from using material which was used before more than 150 years and made them believe that this material can label. And nowadays, it's not something which is easy. And I thought in my mind, when I meet some people like the legend that we have and like you, it will be harmful because you insist on your opinion. And the thing that I saw, you are very open to discuss and accept the other opinion. And this is the thing that I want to be the young people to learn also. We don't need to insist on opinions.
Maybe still I'm struggling. Anyhow, I enjoyed this program very much. Thank you very much.
Thank you so much, Prof. See you soon again. Thank you so much. Thank you.
Tokuyama Talks,